Hello. Okay, bye. A very good afternoon, everyone. It is a great privilege and honor to welcome you all to today's webinar on the extremely important topic, oral health versus systemic health. Before we commence this enriching academic session, we would like to take a moment to introduce our esteemed organization, the Sangat Sai Pai Peru Sikh Educational Society, whose origins trace back to the pre-partition era of India and Pakistan. The society has made significant contributions to education by successfully establishing and managing several schools across the Malwa region of Punjab. Our institution, the Dashmesh Institute of Research in Dental Sciences, under whose patronage this webinar is being organized, stands as another proud and valuable contribution of this distinguished society. Established in 1992, the Dashmesh Institute of Research in Dental Sciences was founded under the benevolent and visionary chairmanship of the great reformer, educationalist, and philanthropist Sardar Karnail Singh Dod Sir.
The institution continues to flourish under the distinguished leadership of Sardar Gurdev Singh Brar Sir, IAS retired, whose vision and wisdom guides the society towards new milestones. The society is further strengthened by its dedicated executive members, including Dr. Gursevak Singh Sir, Director, Sardar Jasveer Singh Sandhu Sir, Secretary, Sardar Swaranjit Singh Gill Sir, Joint Director, and Sardar Gurmeet Singh Tilno Sir, Executive Member, all of whom are selflessly committed to the cause of education and societal betterment.
With an initial intake of 60 PDS seats, the institute steadily grew and was formally recognized by the Dental Council of India in year 2000, following which the intake was enhanced to 100 BDS seats. Further strengthening its commitment to advanced dental education, since 2008, the institute has been offering MDS programs in 7 specialities with a current annual intake of 18 postgraduate seats and is primed for further expansion with an upcoming upgrade in the 5 postgraduate specialities. The institution also provides BDS students with foundation course on the basis of new education policy, including value-added courses and elective courses integrated.
Today, the Shamish Institute of Research and Dental Sciences proudly stands as one of the Punjab's leading NAC-asserted private dental college, widely recognized for its academic excellence, university toppers, gold medalists, and national achievers. Beyond dental education, the society has significantly contributed to healthcare education through its institutions in nursing, physiotherapy, pharmacy, dental mechanics, and dental hygiene.
Today's webinar on oral health versus systemic health reflects the spirit of this commitment, bringing awareness to the profound connection between oral health and overall well-being. We are confident that today's session will be enlightening, informative, and highly beneficial for all participants. With these words, we warmly welcome our esteemed speaker, faculty members, students, healthcare professionals, and all attendees. We also kindly request all participants to keep their videos and microphones turned off during the session. Any queries may be submitted in the chat box and will be addressed at the end of the session. At this point, we invite you to watch a short video highlighting our institution. Thank you.
Now, I respectfully invite our esteemed principal, Sir, Dr. M.K. Sunil, to kindly address all the participants.
Very good afternoon, one and all. I welcome you all. The series of webinar. Today's webinar is organized by the Department of Periodontology on oral health versus systemic health. I first of all take my opportunity to thank our management, our director, sir, Dr. Gurusevar Singh, sir, and Joint Director, Swanajit Singh Gill, sir, and other members of Executive Committee who have supported in organizing such series of webinar in our college. I think today's topic it's very interesting related to the oral health and systemic health. So we call it as oral cavity is a mirror of all systemic diseases. So definitely the today's speaker definitely will highlight about the various aspects that concern to that of oral status that relate to the systemic disease. I welcome the renowned and the prestigious speaker in our country, Dr. N. Sapna, and who is completed her postgraduate from College of Dental Sciences, Davangere, and presently working as professor and head of the department at RV Dental College, Bangalore. So I welcome you, madam, on this prestigious webinar series at our college, organized by our college. I welcome the faculty members, Dr. Nitin and Dr. Pritika, and other members who have been uh, timeless efforts in organizing such a webinar series in our college. And I welcome all the head of the departments and the other faculty members and the delegates who have been enthusiastically listening and you want to know about, highlight about, know the concerned topic which is more interesting on the systemic and oral health. I welcome you all once again for this webinar series organized by Department of Periodontology at the SMESH Institute of Research and Dental Sciences for IPRO. Thank you.
Thank you, sir. Now I would like to invite our professor and head of the Department of Periodontology and Oral Implantology to kindly introduce the distinguished speaker for today's webinar.
Yeah, good afternoon, one and all. It gives me immense pleasure to introduce Dr. Sapna N, who is BDS from Cords Davangere and MDS also from Cords Davangere. And she was Dr. Vandana KL's student, who is a very renowned periodontist, known to one and all in the country, who was also my guide. Then presently, Dr. Sapna is working as in charge head of the Department of Periodontics at DAPM RV Dental College, Bangalore. She has more than 104 publications in scientific journals and 8 books to her credit. She also has delivered 12 guest lectures and 18 scientific presentations at various conferences in India and abroad. And she is actively involved in organizing various events related to the ISP, that is the Indian Society of Periodontology, that is Oral Hygiene Day, World Oral Health Day, various conferences, pre-conference courses, walkathons, and for creating other public awareness programs. Apart from this, the other areas of interest that she likes to give her time on is periosystemic link, local drug delivery agents for managing periodontal diseases. Thank you, and I give the mic over to Dr. Sapna now.
Thank you, Dr. Nitin, for the introduction. Before I start my presentation, I would like to thank the management of Dasmes Institute of Research and Dental Sciences, Principal Dr. M.K. Sunil sir, and my friend Dr. Nitin Khullar, and the Department of Periodontics for inviting me as a guest speaker for this event. May I start my presentation? Am I audible?
Yeah, Sapna,
Yes,
you're
ma'am,
audible. You can start.
Can I start sharing?
Yes, please.
Yeah. So the request has been sent for sharing. I'm not able to share.
Yeah, Sapna, just hold on. Just hold on. Yeah.
Hello? It's showing as sharing is not turned on.
Sapna, just share. Just send the request once again.
Yeah, I sent it.
Yeah, she's got it. She's got it.
Okay. Is my screen visible?
Yes, it is visible, Sapna. You can start.
Yeah. Thank you.
Okay.
Good afternoon to one and all. I'm Dr. Sapna N, in charge head of the Department of Periodontics from DAPM RV Dental College, Bangalore. And on this occasion of World Oral Health Day, so the topic for today is oral health versus systemic health. So I would like to begin my presentation with a German proverb which says that if you have lost wealth, you have lost nothing. If you have lost health, everything is lost. It tells you certainly that the value of health in your life. When we talk about health, it is not just about systemic health, it is also about oral health. And as it is rightly said, mouth is a gateway to the body. So if you take care of your oral health, you take care of your systemic health as well. So on this topic, I would like to discuss the following headings. What is periodontal medicine? Is there any link between oral health and overall health? And if there is any link, how one system is going to affect the other system and what does the evidence say? So the contents for this seminar are the following, which I will be dealing in detail. So I use a term called as periodontal medicine. I'm sure all the PGs are aware of this term, though UGs may not be aware, but still I would like to say what is periodontal medicine. According to Orphan Baker in the year 1996, periodontal medicine is a rapidly emerging branch of periodontology. What it focuses? It focuses on a data that establishes a strong relationship between periodontal health or disease and systemic health or disease. It's a two-way relationship. That means periodontal health or disease can have an effect on the systemic disease, and the systemic disease or health can have an effect on the periodontal health. So how did it start? What happened? How did they think that this oral health can have an effect on the systemic health? Way back in 1890, a person called as W.D. Miller, he wrote a paper titled The Microorganisms of the Human Mouth, the Local and General Diseases which are caused by them. So he was well aware that the oral microorganisms can play a havoc and can create disease in the body. Not only the oral disease as well as the disease elsewhere. Similarly, in the year 1900, William Hunter said that oral sepsis is a cause of disease. And he also attacked on conservative dentistry, and he told that you're following septic dentistry. Means you're restoring the tooth, that means you're conserving the microorganisms, thereby leading to various problems. Frank Billings in the year 1911, he used a term called as focal infection. According to him, the focus of infection is defined as circumscribed area of tissue infected with pathogenic microorganisms. And he also advocated removal of all foci of infection. In this concern, removal of all teeth. Then gradually people started understanding that if you remove all the teeth, still the general health is not improved. So many people opposed to this focal infection theory. And some people said instead of going for radical dentistry, you should follow conservative dentistry. So there was a gradual decline in the focal infection theory. However, this focal infection took a momentum again in the year 1994, where a paper was written as Focal Infection Revisited. According to this paper, there are three mechanisms by which oral microorganisms can contribute to systemic diseases. Okay, these three ways are metastatic infection, metastatic injury, and metastatic inflammation. What do you mean by metastatic? That means it originates in one area and it is going to affect the distant organ. So the bacteria that are present in the oral cavity can introduce into the blood circulation and can cause infection elsewhere. Not only the bacteria, even the bacterial products, they can cause metastatic injury, and because of this injury, there is metastatic inflammation. So three things: metastatic infection, metastatic injury, and metastatic inflammation. So if you can see this picture, it's a phylogenetic-like tree which shows that various conditions that are linked to periodontal disease. You can see so many conditions. Till now, total of 57 systemic conditions have been linked to periodontal disease according to this registry. The various systems that may be affected by periodontal diseases are reproductive and urinary system, nervous system, digestive system, neoplasms, cardiovascular conditions, musculoskeletal conditions, respiratory tract diseases, and many more. So now we are going to discuss what is the link between the oral cavity and the systemic disorder. If there is any link, is it just an association or is there any causative link? And this we are going to based upon the evidence. The first system that we are going to discuss is periodontal disease and cardiovascular system. Various cardiovascular conditions linked to periodontal disease are atherosclerosis, coronary heart disease, angina, myocardial infarction, and cerebrovascular accident. So what is this atherosclerosis? Atherosclerosis is a progressive disease. It mainly affects large and medium-sized muscular artery and large elastic arteries. Initially, there will be deposition of the plaque in the artery and they gradually increase in size and lead to blockage of the artery. And this blockage of the artery can lead to coronary heart disease, myocardial and cerebral infarctions. So, how this atherosclerosis is formed? You have to remember a very key point in this is that the inflammation is a key factor in the development of atherosclerosis. This inflammation could be anything. Okay, when we talk about periodontitis is also an inflammation. So this could also be a key factor in the development of atherosclerosis. So what happens? Maybe because of the dietary habits or the sedentary lifestyle or many other factors, LDL cholesterol accumulates in the blood vessel, in the arteries. And it provides a signal by which the endothelial lining of the blood vessel gets attached to the immune cells, that is white blood cells, mainly monocytes and macrophages. Once they get attached to these monocytes and macrophages, they engulf these LDL. They eat these LDLs and they become foam cells. Okay. Along with that, there is also a formation of fatty streak. And this fatty streak formation is the beginning of the atherosclerosis. Now this fatty streak is formed, it gradually increases in size, it grows and then forms a fibrous cap. Now if there is any trigger, it may be infection or any other trigger, this fibrous cap gets dislodged and it enters the major arteries causing the blockage. Once there is blockage of the artery, it can trigger a heart attack. That is how atherosclerosis can lead to heart attack. Now how this periodontal disease can lead to coronary heart disease. First is platelet aggregation. Its effect on the platelet aggregation. Okay. Whenever any clot is formed in the body, first step is platelet aggregation. This periodontal infection increases the platelet aggregation. How does it increase platelet aggregation? One is it attaches to the bacteria gets attached to the platelets. Next is bacterial products activate platelets. Third is these microorganisms, they have a protein called as platelet aggregation associated protein. By these three mechanisms, they cause platelet aggregation. Second factor is, as I already discussed, about formation of foam cells and formation of atherosclerosis by LDL and monocytes and macrophages, which is again triggered by the inflammation and the cytokines present. Third mechanism is acting on the pro-inflammatory mediators. In periodontitis, there is increased number of cytokines. They result in smooth muscle proliferation, resulting in the thickening of the vessel wall, and then they also facilitate coagulation and thrombosis, leading to atherosclerosis. This is how the periodontitis may have a link in the development of cardiovascular events. So this is a flow chart working model of periodontitis atherosclerosis syndrome. If you can see, periodontal infection will lead to host microbial interaction, leading to increased oxidative stress. Once there is increased oxidative stress, it will lead to formation of atherogenic LDL from the non-atherogenic LDL. They enter the circulation, forms atherosclerosis. This is a working model of periodontitis as a risk factor for coronary heart disease. The microbes, periodontal pathogenic bacteria, they can have two effects on the vascular system. One is directly, another is indirectly by their endotoxins and cytokines. They cause vascular injury. Once the vascular injury happens, then there is increased abnormal lipid profile and also increased inflammation. These two together leads to atherosclerosis formation. Once the atherosclerosis formation takes place, the environment changes from procoagulant cascade to the coagulation cascade. And this coagulation cascade will lead to thrombosis formation and then leading to ischemia. So this is how periodontitis acts as a risk factor for the coronary heart disease. Okay. Now we spoke about how periodontitis is going to affect the cardiovascular events. Let's see, if you treat the periodontitis, what will happen? Is there any reversal of the condition? That's what we are going to see. When you do periodontal treatment, mainly what we are talking is non-surgical therapy, that is your scaling and root planing. When you do scaling and root planing, what happens? There is decreased inflammation, that is decreased C-reactive protein and interleukins. There is decreased blood pressure, there is decreased carotid thickness, decreased LDL. All these are the contributing factor for cardiovascular disease. So once these are reduced, it leads to reduced cardiovascular events. So this association has also been proved, and it is, when you use this Bradford-Hill criteria to show the causal association, many of these factors are proved, like your temporal relationship. That means periodontitis comes before the cardiac event. Then experimental reversibility, that means if you do the treatment, you can reverse the cardiovascular condition. Biologic plausibility, that means you can link periodontitis to cardiovascular disease. There is a mechanism. Without mechanism, you cannot explain. So there is some biologic mechanism which shows that periodontitis can cause cardiovascular events. So all these criteria are fulfilled. However, statistically, the strength of association is still weak to moderate. To summarize, periodontal infection can influence formation and progression of atheromatous plaque. There is an association between periodontal disease and cardiovascular disease. Periodontal therapy reduces inflammatory mediators. However, it may not be able to reduce the risk of cardiovascular disease. So if you take care of your oral health, it will definitely take care of your cardiac health, and they can foster a long life friendship. So this is especially useful for the PGs. Okay, this is a timeline showing the various studies that have been done linking periodontitis with cardiovascular condition starting from 1900 to 2020, showing various types of disease, cross-sectional, longitudinal and interventional studies. I recommend PGs to please read this article. It's a very good article and the reference is given here. Please refer this. Next condition is infective endocarditis. What is infective endocarditis? It's a microbial infection of the endothelial lining of the heart. Many organisms are responsible, like Staphylococcus aureus, Streptococcus viridans, Enterococci, etc. However, periodontal pathogens rarely cause infective endocarditis. So then why are we bothered? If periodontal microorganisms are not causing, then what is causing infective endocarditis? Various procedures, dental procedures, and even manipulation of the tissue can cause bacteremia. For example, if you look at this table, you can see that periodontal scaling causes bacteremia in 8 to 80% of people. Tooth brushing causes bacteremia in 0 to 40% of people. Irrigation causes bacteremia in 7 to 50%, and chewing in 17 to 51% of patients. That means your periodontal procedures or even your regular oral hygiene measures can cause bacteremia. So if patient is at risk of developing infective endocarditis, it can lead to certain events. So what do you do in those patients who are at risk of developing infective endocarditis? Whenever you are doing dental procedures, especially these periodontal procedures and other invasive procedures, follow this antibiotic prophylaxis. Amoxicillin 2 grams, half an hour to 1 hour before. If not able to take orally, give ampicillin. If allergic to penicillin, give clindamycin, azithromycin, and cephalexin. If you are not able to take it orally, give cefazolin and clindamycin. So, bacteremia can occur not only by dental procedure, it can even occur by mild manipulation of the periodontal tissues such as brushing, chewing, and using irrigation devices. So, major risk for infective endocarditis comes from poor oral hygiene and dental disease than from the dental procedures. So, our emphasis should be more on oral disease prevention and maintaining a good oral hygiene than just routine use of antibiotics. Next condition is periodontitis and diabetes. It's a two-way relationship, one affecting the other. We shall discuss how it affects each other. Uncontrolled diabetes. What happens in case of diabetes? There is shift in the gingival flora, there is hyperglycemia, and there is adiposity. All these things will lead to increased oxidative stress and alteration in the immune system. There is increased elevation of cytokines. All these things will lead to enhanced bone and connective tissue destruction and impaired bone and connective tissue repair, leading to exacerbation of periodontitis. This is how diabetes will cause periodontitis. Now let's see how periodontitis is going to affect diabetes. It worsens the glycemic control, causes more diabetic complications, and it has also been told that if patient is not having diabetes and he has severe periodontitis, it can even cause new case of diabetes in healthy patients and also may cause gestational diabetes. And it is also showed that in healthy periodontitis patients, there may be moderate hyperglycemia. So what is a mechanism? Again, it's an inflammatory mechanism. Periodontitis is an inflammatory condition. So it affects the inflammatory process. So there is increase in all the cytokines, interleukin 1 beta, interleukin 6, tumor necrosis factor, matrix metalloproteinases, etc. They are increased not only in GCF and saliva, they are also increased in serum, and that is systemic elevation of the cytokines. Once there is elevated levels of cytokines, they lead to insulin resistance. And that insulin resistance can lead to inflammation, oxidative stress, and apoptosis. So now how untreated periodontitis can lead to exacerbation of diabetes. In untreated periodontitis, there is increased circulating bacteria and bacterial products, increased cytokines. They lead to systemic inflammatory state. This causes reduced insulin sensitivity and leading to diabetes or exacerbation of diabetes. Exacerbation of diabetes will lead to increased diabetes complications. That is how untreated periodontitis can cause exacerbation of diabetes. So what it has been proved? Periodontitis, severe periodontitis increases HbA1c level significantly, not only in diabetic as well as in non-diabetic patients. So if you do treatment, now what will happen? Is it going to reverse diabetes? So when you do periodontal treatment, reduced circulating bacteria and bacterial antigens, reduced cytokines. Once these are reduced, there is reduced inflammation in the body. It increases insulin sensitivity and improved HbA1c levels. So less diabetic complications. So what it is proved? Periodontal treatment has modest effect on the glycemic control, and significant reduction of HbA1c is seen 3 to 4 months after the periodontal therapy. So again, this is a timeline showing the various studies linking diabetes and periodontitis from 1900 to 2020. Next condition is periodontal disease and respiratory system. Few statistics. Lower respiratory infection is the third commonest cause of mortality worldwide, and COPD is the sixth leading cause of mortality, followed by pneumonia and influenza. How it is relevant? How these respiratory conditions are relevant to us? There is an anatomic connection between the oral cavity and lungs. Not only that, they also share microflora. So, periodontal disease may influence the course of respiratory disease. So, what is the role of bacteria in respiratory infections? It has been found that respiratory pathogens are found in the oral cavity, and also periodontal pathogens in patients with severe periodontitis are found in the lungs. So they share the microflora, and teeth serve as reservoir for the respiratory infections. So this is a mechanism by which periodontal pathogens, especially P. gingivalis, can trigger respiratory infection. If you look at this, P. gingivalis release various enzymes so that the receptors are exposed. It alters the mucosal surface so that the H. influenza, that is a respiratory pathogen, can attach to the receptors and can enter the respiratory.
आप असम से हो क्या?
Next,
असम से
the
हो?
condition is
नहीं.
pneumonia. What is
नहीं, कहाँ से
pneumonia?
हो?
Pneumonia is defined as inflammation in the lung parenchyma initiated by microbial infection. So it may be community acquired or hospital acquired. Okay. However, the major concern is the hospital acquired pneumonia. So when they compared the oral colonization by the respiratory pathogen, how many respiratory pathogens were present in the oral cavity in patients who are in ICU and in patients with outpatient, they found that 65% of patients in ICU and 16% of outpatients were colonized with respiratory pathogens. And they can be aspirated, like from the oral cavity, they can be aspirated and they enter into the lower airway, causing infection. So the proposed mechanisms, how there is contamination of the lower respiratory tract from the oral cavity. One is by aspiration of the oropharyngeal content. Second, by inhalation of the infectious aerosols. Third, by spreading of infection from the adjacent site and through blood circulation. So 4 mechanisms by which oral cavity can contaminate your lower respiratory tract. So if you do treatment or if patients start, you said when there is poor oral hygiene or periodontitis, it will affect the respiratory system. If oral hygiene is improved or if treatment is done, is it going to cause any change in the condition? It has been said that when oral intervention is done, it reduces or controls the development of pneumonia. And also, it improved oral hygiene reduces the incidence of pneumonia cases. However, little evidence is present that improved oral hygiene reduces the length of the hospital stay or the mortality caused by pneumonia. Next is chronic obstructive pulmonary disease. Here there is obstruction to airflow and there is excess production of sputum, resulting in chronic bronchitis or emphysema. The major risk factor is smoking, and you know smoking is a risk factor for periodontitis also. So they share a common risk factor. Okay. However, studies have not shown or shown very weak association between periodontal disease and airway obstruction. That means periodontitis may not be causing, but smoking may be causing COPD than periodontitis itself. So to summarize this condition, oral microbiome is an important determinant of lung microbiome. So however, there is still an unexplored area where you can think of changing the oral microbiome so that you can change the lung microbiome. It is, however, this is still in infancy. Next is periodontitis and adverse pregnancy outcomes. What are the various adverse pregnancy outcomes? Preterm low birth weight infants, preeclampsia, miscarriage, and intrauterine growth retardation. So, Offenbaker in the year 1996 was the first person to identify periodontitis as a risk factor for preterm low birth weight infants. And what is the mechanism linking periodontitis to adverse pregnancy outcome? We have already discussed three mechanisms, that is metastatic infection, metastatic injury, and metastatic inflammation. Same mechanism holds good here also. This is how periodontitis may affect adverse pregnancy outcomes. That is focal infection model. So if you look at this picture, it tells you that periodontitis is there. It has bacteria. These bacteria enter fetoplacental unit and cause infection there. And next, bacterial products, they enter fetoplacental unit and cause impaired organ development and membrane rupture. Next is inflammation, increased cytokines and PGE2. They also enter fetoplacental unit, causes uterus contraction and preterm birth. Bacteria and bacterial byproducts, they also enter maternal liver and cause increased TH activities of increased TH2 and TH regulatory cytokines, and also increase in cytokines. They cause preeclampsia, low birth weight, and preterm birth. And this preterm birth can lead to miscarriage, perinatal mortality and morbidity, and long-term disabilities. So now this is how periodontitis will affect adverse pregnancy outcome. So now what will happen if you do non-surgical therapy? If you control periodontitis, is it going to improve the condition? It has been shown that doing non-surgical periodontal therapy has no evidence that it is going to alter the incidence of preterm low birth weight and preeclampsia. Why? If you know, most of the time we do non-surgical periodontal therapy or periodontal therapy in second trimester in pregnant women, because that is the safest period. If patient has severe periodontitis, already by second trimester, the bacterial byproducts would have reached fetoplacental unit and may have induced irreversible metastatic injury. So what is prudent to do? It is better to restore the maternal periodontal health during preconception period to improve the pregnancy outcomes. So again, this is timeline showing the various studies linking pregnancy and periodontitis. Next is periodontitis and metabolic syndrome. What is metabolic syndrome? It's a multiple conditions like visceral obesity, insulin resistance, hypertension, high triglycerides, and low HDL cholesterol. If a person has 3 or more of these, he is said to be suffering from metabolic syndrome. So in this, we are going to discuss about obesity. If you look at this picture, obesity and periodontitis, they share many risk factors like genetic risk factor, socioeconomic status, lifestyle disorders, and aging. So now how obesity will cause periodontitis? If you look at this picture, it clearly shows that in obesity, there is increased adipokines, increased appetite hormones, cytokines, and free fatty acids. These will lead to inflammation, insulin resistance, hyperglycemia, and then periodontitis. Similarly, obesity will also cause change in the oral microbiota, intestinal microbiota, causes hyposalivation and xerostomia, and induce stress. All these things can lead to periodontitis. Next, how periodontitis will cause obesity. This you may feel how periodontitis is going to cause obesity. Let's see. In periodontitis, again, there is increased appetite hormones. And because of increase in appetite hormones, you start taking more food. That can lead to obesity. In periodontitis, increased cytokines levels are present, leading to inflammation, insulin resistance, and hyperinsulinemia and obesity. And because of periodontitis, patient may lose teeth, and they may also become mobile, and patient will not be able to chew properly. So they tend to eat more of soft, high calorie diet, can lead to obesity. Oral aesthetics is affected in periodontitis, leading to reduced social and physical activity, leading to obesity. And intestinal microbiota is also altered, leading to obesity. So now what will happen if treatment is given? Okay, it has been shown that if you do periodontal therapy, it improves metabolic components. That means all the components that I told you, all those parameters are improved if periodontal therapy is done. However, adding antibiotics did not yield any additional benefit. So now what? If patient wants to lose weight, he loses weight. Will it improve the periodontal condition? Yes, of course. If weight loss has occurred, it will also have a beneficial effect on the periodontal parameters because the inflammation in the body is reduced. So this condition has both clinical as well as public health implications. Next condition is periodontitis and rheumatoid arthritis. Rheumatoid arthritis, it's a chronic condition, autoimmune condition affecting joints with varying severity among patients. First biological link between these two conditions was identified by Niederman and McCarthy in the year 1982. However, it is said that Hippocrates cured arthritis by pulling out the infected teeth. So what is the role of bacteria in association between rheumatoid arthritis and periodontitis? It has been found that periodontal bacteria and the DNA of periodontal bacteria are found in the synovium of rheumatoid arthritis patients. And it has also been said that the periodontal pathogenic bacteria, that is P. gingivalis, causes citrullination of the both host and bacterial peptides. So what is the mechanism? If you see this is called as two-hit model given by Golub et al. There is a trigger. First is a trigger. What is the trigger? Periodontal inflammation is the trigger. When there is inflammation, there is increased P. gingivalis. This P. gingivalis causes citrullination of the bacterial and host peptides. Once the citrullination occurs, there are antibodies developed against these citrullinated peptides. This is called as ACPA, that is anti-citrullinated peptide antibody. These ACPA, they enter the joints and they cause inflammation there. Okay, now the inflammation has reached and even the ACPA has reached. Now the inflammation has reached. Now this is a second hit. That's why it is called as two-hit model. Second hit of inflammation in the joint is again citrullination, again production of more antibodies leading to more inflammation in the joints. That is how periodontitis can lead to more inflammation in the joints. To summarize this condition, causal relationship between these two is not yet proved. Okay, it is more of syndromic relationship than the causal relationship. In case if it is proved that periodontal inflammation can cause rheumatoid arthritis, periodontal therapy can be an inexpensive, non-pharmaceutical way of improving rheumatoid arthritis. Next condition is periodontitis and cancer. Various types of cancers, brain cancer, lung, liver, spleen, everything is affected by the periodontitis. What is the mechanism? It said that inflammation will cause more release of free radicals, and this causes oxidative stress, causes DNA mutation and cancer. And the organisms, P. gingivalis and A organisms, they also cause damage to the DNA of the neighboring cells, causes mutations in the proto-oncogenes and tumor suppressor cells. And it is said that periodontal infection causes release of acute phase reactants in the liver and causes persistent low-grade inflammation, causing increased risk of precancerous lesions and cancers. So there are various cancers like head and neck cancer, cancers of digestive tract, pancreatic cancer, lung cancer. They all have positive association between periodontitis with periodontitis. However, gastric cancer and colorectal cancer have no association or very unclear association with periodontitis. Next is Alzheimer's disease and periodontitis. Worldwide, approximately 47 million people have dementia and 60 to 80% people have dementia of Alzheimer's type. There are various factors affecting this Alzheimer's, that is diabetes, stroke, cardiovascular disease, hypertension, obesity. And the common link between all these conditions is inflammation. So inflammation triggers the Alzheimer's. So what happens? The model of effect of periodontal disease on Alzheimer's pathogenesis. If you see, this is a peripheral compartment and this is central compartment divided by blood-brain barrier. Here, because of periodontitis, there is increased number of cytokines. Okay, and also sometimes in periodontitis, there is reactivation of herpes virus. These cytokines and reactivation of herpes virus, they cause deposition of amyloid beta. And now these cytokines, amyloid beta, everything, they enter the brain through this blood-brain barrier. Again, there is inflammation here also in the brain, causes neuronal degeneration and also more deposition of amyloid beta and reactivation of herpes virus. All these things will lead to Alzheimer's. It is said that herpes virus, reactivation of herpes virus is also one of the triggering factor for Alzheimer's. So to summarize, periodontal disease induced systemic inflammation, causes disruption of the blood-brain barrier, neuroinflammation, and cognitive impairment. Okay? And herpes virus alone or along with bacteria can affect Alzheimer's disease pathogenesis. However, interventional trials should be performed to define causality and the implicated pathways. The next one is COVID-19 and periodontal disease. Thankfully, we are out of it. Now we don't have to worry about this condition, but still how these two were related at the time, let's see. COVID-19 was caused by coronavirus, which belonged to the Coronaviridae family. Okay, and most of the patients with COVID-19 developed mild symptoms. However, 14% people required hospitalization, 5% ICU, and 2% lost their life. So, what is the mechanism? Hypothesis by which periodontitis might aggravate COVID-19 is that when you aspirate periodontopathic bacteria, it induces the expression of angiotensin converting enzyme 2. This angiotensin converting enzyme 2 is a receptor for SARS-CoV virus. And once they get attached, there is inflammatory cytokines in the lower respiratory tract, causing severe adverse coronavirus infection. And also it is said that periodontal pockets could also act as viral reservoir. And in periodontitis, there is strong TL17 response that could exacerbate the cytokine storm in COVID-19. So, there is no causal link between periodontitis and increased rates of adverse outcomes in COVID-19 patients. However, if that was established or if it is going to be established in future, periodontal health may become an important part of the care of these patients. So other conditions which I'm not going to discuss because of the lack of time, the other conditions that may be linked to periodontitis are systemic lupus erythematosus, liver diseases, chronic kidney diseases, hypertension, gastrointestinal conditions, erectile dysfunction, and osteoporosis. To conclude, periodontal medicine is a term used to describe how periodontal infection or inflammation may impact extraoral health. And we have already discussed that periodontitis has been linked to over 50 systemic diseases and conditions. But periodontal medicine is not only of clinical significance, it is potentially of great public health significance. Why? Because periodontitis is both preventable and treatable. And if you can prevent and treat this condition, it will definitely improve the prognosis of several systemic diseases and conditions. So what should we do? We should educate public regarding the oral hygiene and the oral health. We should educate dental professionals as well as medical professionals so they are aware of this link that periodontal health affecting the systemic health and vice versa. So then we can make this world a better place to live in with a great health. With you here, I know that life is much more fun. This is what we can tell to our health. Be healthy and be happy. Thank you.
Thank you, ma'am, for your insightful and enriching presentation. Your expertise and clarity has truly enhanced our understanding and made this session highly valuable for all of us. I now respectfully invite our esteemed principal, sir, to kindly conclude the webinar.
Hello, Dr. Sapna. It was a wonderful presentation.
Thank you. Thank you so much.
Very crisp. and informative. And the diagrams and lovely. You really made it happen. And then it just took us through sail it through the very good presentation. Thank you so much.
Thank you, ma'am. Thank you so much.
Thank you, Sapna, for the wonderful presentation. Principal sir is busy in a
Thank
meeting,
you.
so I'll
Hi,
conclude on
Nitin.
his behalf.
Okay, okay.
Yeah, so it was really insightful, and we learned so many new things. In fact, my PGs have clicked a few pictures of your slides, and we will put it in our lectures now. So
Hi,
thank you so
Nitin.
much. Thank you, and I'll just invite my co-professor, Dr. Pritika, to give a vote of thanks. Yeah.
Nitin, it's good to see you. Hi, Nitin.
Hello, who is
I'm
this?
here. Hi, Nitin. Vandana.
Oh, okay, ma'am. Hello, ma'am. Good afternoon. Good
Yeah,
to.
very,
I
very good
can't see you, ma'am.
afternoon.
I don't know where
I
have
know
you.
I have not made the video on.
Okay, okay, ma'am. Okay,
Okay,
ma'am.
but I think just for your sake, I just put it on, and then it's good to see you.
Yeah, yeah, good
Lovely.
to see you too, ma'am. Good to see you
Yeah,
too.
and Sapna
After a
did a
long
very
time.
good job.
Thank you,
you,
ma'am,
ma'am.
for
Thank
being
you so
here.
much.
Thank you so
Yeah,
much.
yeah. She always sails through this topic, and it's a very tough topic, according to me. Putting
Yes,
everything
ma'am.
together,
Definitely.
and she did a very good job. Thank you, Nitin, and
Thank you
nice
so
to
much,
see you.
ma'am. Thank
Yeah,
you. Thank you,
yeah.
ma'am. Thank you.
Bye bye. Take care.
Bye, ma'am.
Good afternoon, everyone. It gives me immense pleasure to be part of the series of webinars started under the Shmesh Academy of Continuing Dental Education. As we conclude, I'm honored to propose a vote of thanks. First of all, I'm honored to propose a vote of thanks and give heartfelt gratitude to our speaker for today, Dr. Sapna N, for enlightening us with her talk and sharing the valuable insights. Thank you, ma'am. I also want to express immense gratitude to the members of the management, Dr. Gursev Singh sir, Sardar Swaranjit Gill sir, and also our worthy principal sir, Dr. M.K. Sunil, for giving us this opportunity. I thank all the faculty and the PGs of the Department of Periodontics, DERTS, and last also our technical team for their cooperation. Have a wonderful day. And announcement for the participants, the certificates will be provided to them in their respective emails. Thank you so much.
Thank you, everyone. The participants can now leave the session.